I'm with Matron Dean at Conal Hospital in Sierra Leone. The matron looks after the operating department here. And I was thrilled the other day when I gave her our surgical preparation list to hear her positive feedback on it. And I just thought it'd be great to share kind of why you felt that, really, matron.
Yeah, well, thanks. I seen your checklist for the very first time. I knew what an important tool is it as regards safe surgery, because it's one of the measures that WHO is looking at in terms of promoting patient safety in the surgical area. And for me, it looks simple and concise and precise. So me taking a look at it, the anesthesia, that's what we do, the checking that you do before the induction of the patient, and as far as the surgery is concerned, before the skin incision is made, and this tells you what you do before the patient is taken out from the operating theatre. So I was happy. We have a surgical checklist ourselves, as was adapted in 2017, that we are using. We've been using it for almost 2 years now, and we are about re-evaluating it to see that whether we can do some addition or omission on it. So seeing something like this, likewise, I think it was nice. It's a very good tool.
I'm pleased about that, because one of the things we were concerned about is making sure that, first of all, it related to the issues that you face in the environment on a day-to-day basis, and the many challenges that you have to deal with. And the real clear separation of anaesthesia, surgery and recovery, with all the hard practicalities that you face on a daily basis.
Yeah, it does, because that is like, it encompasses what they're saying, because according to Global Surgery, WHO is saying that one of some of the things that you look at in terms of promoting patient safety is safe anesthesia, which is already captured here. You talk about the safe surgical team. I think we'll also find some of it here, and also we also have talk about the surgical indicators, which you can also find alongside this one. So I think it's a component of everything.
And I think so as well, because one of the things that we're always keen to do is to help you to teach the generation coming through. And in some respects, it's a teaching plan.
Yeah,
actually.
it's a teaching tool, and it's easier. It's easier.
Yeah. Because, for instance, we haven't taught you how to necessarily do it. We just said, have you got a mechanism for checking your swabs and needles?
Yes.
How you do that is local policy.
Yes,
down to
local
your
use
team.
and county. Like for us here, we have a special sheet for that, which is called the swab count sheet.
Sure.
We are in the nurse and the circulator, the scrub nurse and the circulator counts before the start of the surgery and also before the closure of the skin cavity. So if you've done that, then there's a tick for that box. And if you've answered, tell the surgeon that my swab count is correct, the instrument and needles are correct, then there's a tick for that one.
And that's great, and that's the point, isn't it? It's your system, and so on and so forth. So that's really exciting. So thank you very much indeed. It's been a great joy to be here. Really excited about the Azaroff research project. My first time here to this lovely company, and I've really enjoyed it. So thank you very much indeed.
You're most welcome.
Thank you.
You're most welcome.